Welcome to July Healthy Reset 2026. This week, it's all about you. Are you metabolically healthy? For many years, we waited until we were unwell. Then asked our doctor, Doctor, why am I unwell? What can I do? What caused it? Today, we're going to do something different. Today, you are going to assess yourself. Not to diagnose disease, not to replace your doctor, but to understand your own health so you can make a more informed discussion with your healthcare team. And I want you to use the most important health resource that many of us already have. That's your family. Ask your husband, wife, children, parents, or a close friend to help you. Health is much easier when it's a shared journey. I know this personally. A few years ago, I had almost every major feature of metabolic syndrome. I was overweight, had high blood pressure for 10 years, diabetic, insulin resistance, severe sleep apnea, severe reflux, had to sleep on 3 pillows, and had the potential of losing my vision. Today I'm in remission without the need of medications for blood pressure, diabetes, insulin resistance, or even the need for emergency surgery to prevent vision loss. I didn't achieve this alone. The encouragement, support, and motivation from my children made an enormous difference. That's why I believe lasting lifestyle change is often a family journey, not an individual one. So, let's begin. Please get a tape measure, your recent blood test results, if you have them, and ask a family member to help. Today isn't about passing or failing. It's simply about understanding where you are today. Many people have tried to lose weight or improve their health before, but may have been discouraged. That's okay. Today, we're not asking you to change anything. We're simply asking you to assess your metabolic health and understand your level of risk. Then you decide what to do next. You may choose to continue as you are, or you may decide to discuss your results with your doctor or specialist and explore the options available for you. There are 5 simple measurements that help you understand the risk of being metabolically unhealthy. First, your waist circumference. Measure it at the level of your navel. For people of Asian background, a waist of 90 centimeters or more in men or 80 centimeters or more in women is considered a risk factor. For non-Asian populations, the cutoffs are 102 centimeters for men and 88 centimeters for women. Second, your blood pressure. A reading of 130/80 or higher counts as a risk factor. Third, your blood tests. Look at your fasting glucose, triglycerides, and HDL, the good cholesterol. Use your laboratory reference range. If any result is outside the normal range, count it as one risk factor. one important point. If you're taking medications for high blood pressure, diabetes, or high cholesterol, these conditions still count as a risk factor, even if your numbers are now well controlled. The medication is treating your condition. It doesn't mean the condition never existed. Now let's total your score. If you had 5 out of 5, congratulations. Keep looking after yourself. If you score 4 out of 5, you're doing well, but there's still room for improvement. If you had 3 or more risk factors, I encourage you to discuss your results with your doctor or specialist. Your long-term risks of heart disease, stroke, and type 2 diabetes may be high, and together you can decide on the best management plan. Remember, this isn't about labels. It isn't about blame, and it certainly isn't about perfection. It's about understanding your health and making informed choices and taking the next step, one step at a time. Every journey begins with knowing where you are. Let's begin. If this was helpful, please send us a note. Just a heart. This will also help to encourage all those who are sitting on the fence. Thank you very much for watching. This presentation was brought to you by Dr. Siva Navaratnam, Shimazu Yumi, and ChatGPT, our educational partner. Thank you for watching.